When you suffer a shoulder injury, it's important to recognize the signs and symptoms so you can get the treatment you need. In this video, we're going to discuss 3 common shoulder injuries that result from traumatic events in sports, exercise, and daily life. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. Shoulder injuries are common. They can range from minor strains to major tears. And there's 3 common injuries that you should be aware of: rotator cuff tears, shoulder dislocations, and AC joint separations. There's a lot of others, but these are the 3 I'd like to discuss today. Let's start with rotator cuff tears. What is the rotator cuff? Well, the rotator cuff is a series of muscles basically that attach, and muscles and tendons that attach the shoulder blade to the ball of the ball and socket joint. And they help stabilize the shoulder while the bigger muscles help your arm reach up overhead, out away from your body, or behind your back. Typically, rotator cuff tears are overuse injuries. They can occur with trauma, but usually as you get older, they fail from overuse. It may be painting. You painted a room or a couple rooms over a few days. You did work in the garden, and then you get symptoms that come on later that day, or even a lot of times several days later, and you don't even remember the initial injury. Some of the symptoms of a rotator cuff tear include pain reaching up overhead, out away from your body or behind your back, or more importantly, weakness with those movements in addition to the pain. Now, rotator cuff problems can be anything from rotator cuff impingement or sort of irritation or degeneration within that tendon to a partial tear to a complete tear. Weakness with those motions, again, overhead, out away from your body and behind your back, might indicate a rotator cuff tear. Physical therapy is often a good place to start and might get the problem better completely, especially if it's more rotator cuff impingement. On the other hand, full thickness rotator cuff tears often require surgery to reattach them. All right, let's talk shoulder dislocations. This is an injury where the ball is basically forced out of the socket. Very often, almost always, it's a traumatic event. And usually that's maybe a fall where you land on your outstretched hand and the ball gets forced out of the socket. If it's a sport like football where you're going to tackle somebody, you get your arm jerked behind you and that dislocates your shoulder. Now, the first step is obviously, or you would think obviously, is to have it put back in place. Then it's important to see an orthopedic surgeon to see if any other damage occurred. Maybe the labrum, the cartilage bumper along the socket, maybe the capsule and ligaments that surround and support the ball within the socket. And that basically involves getting a specific type of MRI to see if you have other areas damaged. The problem with a shoulder dislocation is the younger you are, especially in teenagers and very young adults, very often there is other damage involved and you need surgery to stabilize it so it doesn't happen again. And then the last type of injury we're going to talk about in this video is an injury or a separation of the AC joint. The AC joint is the joint between the collarbone and the tip of your shoulder blade. This injury typically occurs with a direct blow. Either another player in a sport like football hits you on the outside of your shoulder, injuring that joint, or you land directly on your shoulder. Typically, if you have an AC joint injury, if it's a severe injury, you'll see a big prominence at that joint. But if it's more severe, what you'll notice is pain directly over that AC joint or pain reaching out across your body. It's important to see a doctor to get x-rays. Sometimes even an MRI can be helpful to look for other damage. If it's a minor injury of those AC joints, then very often rest, maybe a short use of a sling, physical therapy can be enough to get you better. Very significant disruption of that joint where multiple ligaments are damaged, sometimes those need surgery. With all 3 of those injuries, it's important that you see a doctor or orthopedic surgeon. Hopefully you understand that from this video. Getting x-rays or an MRI to learn the extent of the injury and to treat it appropriately. I'd love to hear about your experience with your shoulder injury, maybe if it's any of those types of injuries. Leave those in the comments below. I do read those. Just understand, legally, I can't offer you medical advice online, so a lot of times I don't respond to those comments. But I do try to answer those questions in future Ask Dr. Geier videos. Also, make sure to subscribe to my channel. Click the bell to be notified when I release a new video and when I start another live stream, including my almost weekly Ask Dr. Geier live shows. Thanks for watching. Watch future videos where I hope to help you feel, look, and perform better than ever.